The English proficiency test does not advance care for First Nations people.
The Canadian Nurse Regulators Collaborative have made changes to an English language proficiency test, lowering the required grade to pass. According to one doctor in Manitoba, this test keeps some Indigenous nurses from working in the province, adding these changes aren't enough.
Whether you know English or French as your second language is irrelevant to delivering good care in our communities.
Nursing regulators will now accept scores of 6.5 in the listening and writing components of the International English Language Testing System. A score of 7 was required up until this week.
The evidence that we have suggests that language proficiency changes over time. So a test is then required to verify that you're still at the level that's needed to practice safely.
If you're within 2 years of graduating from a nursing program in Manitoba, you're not required to take the IELTS, according to the College of Registered Nurses. Dr. Barry Lavalley says there are numerous First Nations graduates who have taken this test and not passed.
Why is it that there appears to be a preferential loss of possibility for licensure by Indigenous graduates of a very, very sophisticated nursing school? So you have to take the lens of looking at what is it doing racially to people who are not white.
Dr. Lavalley says tests need to focus more on quality of care and ability to provide racism-free care over English language proficiency. He says this test keeps First Nation nurses from working in their communities in northern Manitoba who are in desperate need of nurses.
Ontario and Saskatchewan welcomes them. Come. But you've disrupted a family, you disrupted the continuity of community engagement and support, which is really important for us. And you're forcing young people to leave their ancestral homes because of this English proficiency test.
Darlene Jackson at the Manitoba Nurses Union says the changes are an improvement, but says it's still an outdated way to measure proficiency. What we need is for leadership to reflect on what is modern speech and modern requirements in our short-staffed healthcare system. It cannot be that nurses born and raised in Manitoba are also failing this test. Martin Lucier with the College of Registered Nurses says he understands the way established regulatory bodies may be based in colonial models of authority, but that the college is open to consultation with Indigenous governance. He says a review of the language proficiency benchmarks is expected to be completed by May.
We are certainly open to dialogue with Indigenous communities and practitioners on evaluating that, and we are at the cusp of launching into a wider consultation process.
In Winnipeg, Mike Albanese, City News.